All right, so we are in Miami right now, and we're at the American Society of Aesthetic Plastic Surgeons conference, yearly conference. There's legit, 2,000 surgeons here, supposedly, from all over the world. And we've been here for what, how long now? 72 hours?
It seems like an eternity, G.
Yeah. We had a big night last night, so, just.
It was one of our boys' birthdays, and we had to go out. So
Yep.
that's what we did.
Yep. And we also had got to hook up with all of our fellows here. So, how many people are here from our practice? It's pretty amazing.
It is pretty awesome.
About-
20,
Yeah.
20 some.
And about eight surgeons. And we are involved in the meeting, maybe a little too involved.
What? Let's tell our listeners what we've done. What are we doing in the meeting?
So we have done, you help me with this. We had the teaching courses. And in the teaching course, we actually work in a small setting. So we had about 70 people in a room. And we talked about the concepts of breast implant fatigue and how to manage that. And what's really interesting, and you tell me, is when we're giving those talks, we're actually directing the conversation. But the way that we roll is we just open it up. So it was fun because sometimes, for 2 hours to talk, it can be painful because you've done it.
Nobody wants to sit and listen to a lecture for 2 hours straight. And so just how we banter back and forth and make it interactive. But why do you do it? We love to educate. That's part of it.
Yeah, but the selfish reason too is that there's always comments, there's always pearls that other people in the audience actually bring up. So by it being interactive, we gain something.
Selfish reason is you like the limelight. Gee.
I love the limelight. I love
That's
it. Not true.
Real selfish reason.
But so let's look at yesterday we had a comment. It was on how to manage implant fatigue, and so that means like what do you do when you're tired of implants, and what's the definition of implant fatigue to you?
In our practice, it can mean anything, but in essence, it is the individual who is just ready to get rid of their implants for whatever reason. They're just over them. They have breast implant illness. They may have textured implants. And they want to avoid that potential risk for ALCL down the line. And it can be any of those things. And we see those oftentimes in our practice.
Yeah.
But we don't just do that alone. We offer reconstructive options. And that's what the talk was all about.
Yep.
And I'm giving the same lecture tomorrow.
Yeah.
Different audience. But in essence, we're talking about what we do in our algorithm for this removal.
Yeah. And what's interesting is that there are people that were there that didn't necessarily understand or agree with the concept of, for example, explant, total capsulectomy, and doing a lift at the same time. Doing a lift at the same time because they're worried about, possible, is the nipple blood supply going to work? And, we've done so many of those that we know we can do it. But just because you want to doesn't mean you need to. But for our patients, we want to try to avoid unnecessary reoperation. So a lot of patients, when they have their implants out, they just want to be done. And so by able to doing it at the same time, we can avoid them in another reoperation.
What's the benefit of fat?
And so, fat, I think a lot of times people think when you're talking about fat, you're talking about BBL. You're talking about something that's artificial looking or almost like an implant again, but it's like the total opposite.
And in our eyes, when we talk about fat grafting in the breast, it is about shaping the breast parenchyma. It is not about volumizing. People assume that you can put fat in that pocket where that implant used to live. And you can get it as big as you want to get it. Mm-hmm. You can't do that. So It's not going to give you that structural fullness. But fat is a good secondary alternative to that implant that will help shape the breast.
Yeah, and the analogy I said, which I think is the listeners may want to hear, and I always tell patients, is that you can do surgery and use fat as an adjunct. And they say, what is an adjunct? Adjunct is like
you can do your carrot cake analogy.
So it's like carrot cake.
Here it is.
Carrot cake is amazing on its own, but carrot cake with icing is even better. So that's kind of how I would describe fat.
And if you've seen G, he's never eaten carrot cake in his life.
I eat it when I need to. All right, so that's what we got. That talk was great. We had any interesting or controversial things that anybody said during that talk?
Yeah, they were just nervous about doing it at the same time. But in essence, to your point, we do it all the time. We can do it routinely. We can do it safely. Patients do remarkably well.
One of the guys in the audience asked if we fat graft the muscle, says that he fat grafts the muscle. And, listening to that, I'm like, okay, I could see that. And then when we dove in deeper, the volume he put in was pretty low. So I think that's something you could consider. It would have to be under direct visualization. Our main concern is the risk of potential bleeding or potentially embolism is the reason why we don't use it. But I think that it probably is safe. And so those are things that we might take home and slightly modify our, practice.
The question, one of the questions we got was, do you do muscle repair? What does that, ultimately mean, and how do you make that decision about muscle repair?
Great comment. And so for the listeners, muscle repair after explant, what is that? What does that mean? So the idea is you take that implant out, and a lot of these implants were put in under the muscle. Behind the muscle is another word that people use. Other word that doctors may use is dual plane. And after you take it out, that muscle has been released down low, and the muscle kind of moves up. The word is called window shade. And so the idea is, why don't you put that back down? I think people are like, well, I want to be put back to where I was before the surgery. Sometimes it's possible very easily, and you just suture it down. Sometimes it's very difficult, and you have to do a significant delamination, which means separating the muscle from the breast. And so all of a sudden you're adding a little bit of a level of complexity to the case. And then when you secure that muscle to the chest wall, to do it well, you have to secure it to the chest wall. Sometimes that can be very painful, and other times it could actually tear away and you can cause more damage. So I'm pretty selective. If I can do it, I do it. If I think it's going to cause a problem, I think it's a bad idea.
I absolutely love doing it. I think it makes a huge difference if you can. Mm-hmm. But to your point, if it's too window shaded up, it's too high, can't do it, it would probably be more negative than positive. And in those cases, definitely not.
All right. So then I think that was kind of a good synopsis of that course and our what we gained from our own course. The next course that we gave was on use of
soft tissue support
in breasts.
And, very interesting topic, slightly controversial because, you hear the word mesh. Is mesh good or mesh bad? But,
mesh is meshy.
Mesh is very messy. But it's one of those things where I think in the right patient, it works remarkably well. And so the topic was on Galaflex.
Yeah.
But is that Galaflex the only mesh that's available?
No, there are multiple other mesh constructs available, but in the aesthetic or reconstructive plastic surgical space, one other product that's available is called Durasorb. And then within the Galatea brand, there's also Galaflex Lite. And so basically what these are...
Let's talk about what is mesh.
Yeah.
Is this a permanent material? Is it something that goes away?
Yeah.
Will the patient feel it? And when do you use it in your practice?
Yeah, so mesh, the connotation that you get from mesh is the scary stuff that you see on the TV lawsuit ads about mesh. And really what we're talking about is something a little bit different. It is a mesh. So mesh literally is a construct that's used for added support in soft tissue on the body. Historically, it's for hernia repair, like inguinal hernias or ventral hernias, which are hernias of the abdominal wall. And a lot of those old meshes were permanent material, like nylon or Marlex or other materials that would be there all the time and that could potentially erode and potentially cause horrific complications. So the products that we are actually talking about are very different because they are absorbable meshes or bioresorbable, meaning they actually integrate into the soft tissue and go away.
And so in layman's terms, they're just like suture material.
Yes.
Just any other suture material that you would end up using in the breast or in the body to close things. It's the same. It's made of the same thing. And what is the purpose of that? Why is it called soft tissue support?
Well, the purpose is that things stretch, things loosen up. For example, in the breast, when you lift something up and tighten it, the tendency is over time, gravity always wins, and things can fall and you can lose support. In certain instances, some patients do it more than others. And the idea or the theory is that if you can strengthen that soft tissue by adding this material there, that you will avoid it. And
do you think that's real? Do you think that placing this material in whatever capacity you want will allow it to stay there forever? I mean, we just said that it's absorbable. It's going to go away. So does that strength go away as well, or does that strength last?
I think it is a little bit of verdicts still out into a certain extent. The data that we've seen from a lot of the users is that it's pretty long lasting, depending on where and what has been used, because there are now different products that go away fast. And I think more than anything, things can be very complicated, and that to uncomplicate them, you have to have a reason for use and a reason for every action that you have, especially with us in the operating room. We don't just do anything just because you can do it. And so you have to make things done for a purpose.
Right, because it's always an added risk.
Yeah.
When you add something, it's an added cost
Mm-hmm.
to the patient, and so you have to make the right decision for that patient.
Exactly. And then I think incorporate the patient in that decision. Like, I sure as hell am not going to be like, you need to use mesh. And this is what's going to be used in the case. I would rather say you could potentially benefit from the use of mesh. Here's why. Here are the added risks.
Yep.
And with this product, they're pretty low risk. I think it's pretty amazing. But we don't just say, this is how I do it.
So how do you use it now? You have a case, you have,
Yeah.
you do it on all your primary augmentations? Do you do it? Because our colleague that we did the teaching course with pretty much uses it on every breast case.
Right.
Which I think is great. His results are absolutely phenomenal. Do you use it on every case?
I don't. I'm very selective with it, and I know you are too. And I think that I use it for revision cases. So in situations where you've done something and it's failed, you bring in something new. So you're not repeating the same thing, The other times is that if I know there's going to be a need for it, or if the patient actually fundamentally wants it. Patients are smart. And this is why I think that what separates us at HKB and hopefully other premier providers is that you have to empower your patient with all the knowledge possible. And once they understand what the purpose is, once they understand why you would use something like that, the pros and cons, then I think ultimately they can be the decision maker. Because somebody always says, do I need it? And I'm just kind of like, the truth is no. I mean,
most of the stuff we do, nobody needs.
Yes.
Right. It's all want or desire. And, it's interesting. You said that a lot of our patients come in asking for it, right?
Mm-hmm.
They want this insurance policy.
Yes.
They want that internal
It's like travel
bra.
insurance for the breast, right? Or somewhere else.
Yeah. They're wanting it.
Yeah.
Or their friend had it. Can I get it? Can I get it too? But I think it's all part of this informed consent process where we have to tell patients, hey, this is the advantage. This is what we can do. Does it work? Does it not work?
Yep.
Can we use it? And let them ultimately be a part of that decision-making process. For us, I would say routinely we use it for implant malposition.
Yes.
I think in those revisionary cases, that extra support goes a very, very long way.
Mm-hmm, mm-hmm.
And then on primary cases, we use it judiciously, depending on the type of soft tissue that the patient has, if they have a recurrent ptosis over time.
Mm-hmm.
In those scenarios, it does play an important part.
Yeah, I agree. And I think that's the key, and is to use it selectively, but also to make sure that it is, I think every surgeon should know how to use it. It's like, if you're going to build or create a masterpiece, you need to have everything in your disposal to, create a uniqueness to that piece of art. So I think it's a valuable tool. I think that it's going to continue to be used in different novel ways. And sometimes I think we use it for even like in a tummy tuck, where someone has a super stretched out abdomen and we do that tummy tuck, we worry that their fascia is not strong and it might actually cheese wire through, or they could have recurrence. We can reinforce that with that mesh. And people get scared when you say, I'm going to use mesh on your abdomen, but this is a mesh that's going to go away and integrate. So what it does is it's like a time that allows the body, it kind of helps the body form the scar in a very purposeful, logical way. And I think that can be really valuable. So I think that was a good conference as well, where we learned.
And what I realized is the participants, the other surgeons, our peers, they really wanted to know how we would address certain problems.
Yes.
Right. Those case studies that we went through, they're like,
Mm-hmm.
oh, you did a conversion from on top of the muscle to underneath the
Mm-hmm.
muscle and then use mesh.
Right.
And so those concepts are foreign to a lot of people.
Right.
And I love that part of it.
Yeah.
Don't you? Like, to be able to kind of showcase some of your results and say, okay, we did it this way and this is how we did it.
Yeah. And sometimes, listen, I think the most powerful thing, which I just want to be real, and I think that people learn the most from, is you can show actually a result that maybe actually didn't turn out how you intended or wanted it to be, but you showed what happened and then what you did. I think that's kind of fun to do. And then also to kind of get input from others. Would you guys have done anything differently? What would you do? And sometimes you can get incredible, ideas from that, because, you're having it looked at through the lens of 60 other people at the same time. So I think that was really fun. How about anything else interesting that you've gained so far from the meeting? What's your favorite part about coming to an event like this for us?
Seeing my colleagues that I've not seen in a really long time. We just literally on the way over here saw a couple of our friends from South America. Hadn't seen in a long time. They embraced us, gave a couple hugs. And
we just saw Javier Soto. I mean, this guy is incredible. He's an amazing surgeon, but his visibility on social media is probably unrivaled from a plastic surgeon standpoint. I mean, millions of followers, and the level of engagement is so high, and the content is just uniquely him. It's really amazing.
It's all about education, right? And one of the main reasons we're doing this podcast is to
Yeah.
be able to educate patients. The very first meeting that we took or talk we had was very interesting. It was on the business side of
Yeah.
life, and our colleagues wanted to know what we're doing with HKB. They're
Right.
blown away with our expansion, and they're like, "What are you guys up to? Why?" I know we covered this in one of the other podcasts, but it was pretty interesting to give them a taste of HKB
Yeah.
at the national level.
It was interesting, and then to really understand how unique what we're doing and what we're trying to do, because not only do we want to provide our patients with the best outcome, the best experience, and we're working to continually improve that. We have a long way to go. We're never going to be satisfied, but that we actually have a responsibility here. Like our space needs this. They need us, and we have got to do right by our colleagues, our fellow plastic surgeons, and the other aesthetic providers that are within our network, because there's lots of things happening in medicine, and if we aren't doing what we're doing, I think it's going to affect the way that aesthetic treatments are provided to patients, because it really was an aha moment for me also, and I think the entire audience that was in there, which are like some of the most premier, thinkers in our space worldwide.
I think they were in awe of HKB and what our mission is.
Yeah.
Which is to give people their best,
Yeah.
and to be there for every one of our employees, every one of our patients.
Yeah.
It's pretty remarkable.
It is.
Are you looking forward to anything else in the meeting?
Yeah, I think a couple of things. We're going to speak tomorrow. You and I both are doing some different things on the main stage. So the main stage is a little different. That's kind of the big mega room where
2,000
there
people.
are hundreds of people in there, and your face is enormous. But my discussion is going to be on augmentation+mastopexy in the massive weight loss patient. And to us, to you and me, and to our practice, the massive weight loss patient is incredible. Going on a little tangent, this concept of losing a person or two people from a weight standpoint, a patient who's journeyed so far, whether they had surgery or lifestyle modification or both, which is usually what has to happen, they're then left with this, significant deformity from all the excess skin. When you look and focus on the breast, they have a significant deformity. It's almost a functional deformity, not just an aesthetic deformity. So what we do is not just skin deep. I mean, these cases are incredible, but they're very challenging.
These are some of the best patients.
The best.
Oh, yeah.
Incredible.
They've done all this hard work to get to where they're at, and then you come in last minute. I always say that we're running a marathon. They've done the first 22 miles, and we get to run the last few with them.
It's amazing.
To the finish line.
And when I'm going to give this talk, it's going to be real, because what I say in this talk, and this is so important,
That you're
is
the best.
I'm the
You
best.
Just tell everybody that it's going to be perfect.
Best breast by Bharti, BBB. So, no, for real. What the thing is that case, we typically do it together. Meaning, if we're going to add volume to the breast and we're going to do a lift, we're going to do it together. But one thing that I clearly say is that in the massive weight loss patient, you're not only going to be taking care of the breast, typically, you're going to address other areas, and you're not going to be able to do it all together because it's too long of a surgery. So in that situation, you typically can get them an outcome that they're proud of and that we're proud of together. But every once in a while, I might need to tweak it. So I always kind of set the stage that you're going to get a result that is satisfactory, but that it might need secondary intervention.
Why is that? Let's tell our audience. Why in those cases would you say that there is a potential need for something else in the future?
Here's the deal. So that person was literally another person in the past. So when you see the change that their body's undergone,
but in their eyes, they're like, I lost weight. I'm healthier. My body should respond better now.
Mm-hmm.
Is that the case?
What's happened is that skin, that soft tissue, can't be exercised. It doesn't snap back. And so it fundamentally behaves differently than an individual who never had that mega weight shift. Okay, there are
a lot of the patients just don't really truly understand the nuances of what that's like until after they've lost the weight.
And listen, that goes back to the most important thing about what we do in every talk we give. Even when you become a big shot, busy surgeon, you have to remember, bring it down, engage with that patient, make sure they understand what the significance of where they're starting, where they're going, build that rapport so they know what it's going to take. But that's the key. And it's funny, if you can anticipate all issues with the patient, there ends up not being a surprise. Even if something difficult or bad happens, they understood it, they knew it. Not only did they sign a consent, but they heard you say it. And then more importantly, you just address it. You stomp it out. And I think that's like this piece about, we're not to call this customer service, but it kind of is. Like, you have to like be there for everything and everyone, whether it be your patient, whether it be for people on your team.
You're not just a technician, are you?
No, you can't be. And I think if people know that and they're taken care of well, people understand that things happen, complications happen. It's about how they're taken care of and how they're addressed. And I mean, that's the whole entire mantra and foundation of this podcast. But it is so funny how that every single thing that we have boils down to that is how do you plan, do, and execute something, and then how do you address it when things aren't how they should be?
Isn't it pretty amazing? Every one of our talks was about how complicated the procedures we're doing are, right, and how we try to uncomplicate them.
Yeah,
to come in full circle.
It's amazing. And then we have another thing, which is another massive weight loss panel that we get to do with some of our incredible colleagues, and we're excited about that. And what's really interesting too is sometimes the discussion of what you bring to the podium, obviously valuable, but sometimes the most important thing is the discussion that happens on stage. Meaning there's a moderator and then there's the discussants. And sometimes these presentations, and I think we want to plug our great friend Simeon Wall when we did our talk on Thursday, where Bill had a talk and I'm not supposed to be on stage, and he literally makes me come on stage with him, which was great. But
we do everything together. Yep. It's like a package deal. But in essence, these discussions it's really good to get differing perspective, because it's not a single way of doing anything.
Yeah.
We typically end up there's a couple roads that get you to the end point, and sometimes one road is better than the other road.
But talk about but that's an important piece, and this is kind of like a life kind of lesson too, where you have somebody like Simeon Wall, who just is a master at this, where he can ask the right question, and then he can frame up a follow-up question, and then make sure that all the discussants are heard and are expressing their opinions. Because what can happen is often you'll have one person just, running their mouth and just wanting to be heard and just talking over others. And he just really just does it so well. And I think that's a real gift.
It's a super amazing gift for those individuals. Because again, you don't want the loudest voice to be the one that everybody hears and think that is the right way. Because in reality, sometimes that's not the right way. Yeah. And it's the person who's shy and quiet, who's not given the opportunity, who actually has a better approach.
Yeah. One of the amazing things that we get to do here too is we get to have our yearly fellowship event, where all the prior fellows who have trained at our program that Joe Hunstead initially started 20 years ago. And so now we have, how many fellows? I don't even know. It's a massive number. And these surgeons are all over the country. They are all...
They're our age, but we always say they're like our kids, and you love to see how damn successful they are. And when I mean successful, I'm not meaning financially. I'm just meaning in their careers. Yeah. They're able to help so many people. They're really great surgeons, and they're just really good people. Yeah,
it's great, and it's just nice to see each other and commiserate about the past and talk about their times as a fellow and then what they're doing now. And like you said, they've all achieved wild success in all corners of the country. It's pretty amazing.
Overall, great meeting.
Exhausting. I'm not going to lie, because you're just running. I think next year I'm going to plan some more downtime, some chill time. I
wanted to be poolside right now, but G made me do a podcast.
Yep. I did overcommit us, but it is all good. All right. Anything else?
That's it.
That was like a mishmash, but it's all good.
Links to learn more about anything mentioned on today's show are available in the show notes. To learn more about Dr. Bill+Kortesis and Dr. Gaurav+Bharti and the entire team of HKB Cosmetic Surgery, just go to hkbsurgery.com or follow HKB on Instagram at HKB Cosmetic Surgery. Subscribe to our newsletter for key takeaways from each episode, links to any resources we discuss, and promo codes or giveaways from HKB and our partners. If this show has helped you in any way, if you learned something, write a review on Apple Podcasts and share the podcast with a friend. Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code PODCAST to receive $25 off any service or product of $50 or more. It's Complicated is a production of The Axis, TheAxis.io.